How's it going, everyone? I'm Dr. Vear from Binger Chiropractic here in Huntley, and today we're with one of our longtime patients, Courtney. Courtney is dealing with some neck pains and upper back pain from repetitive stress at work, and so today I'm going to show you what we do for that, as well as some soft tissue work to kind of help release those muscles of the neck and shoulder. All right, Courtney, go ahead and go face down for me. The first thing we check is the spine, the mid-back. When you sit at a computer or when you deal with kids, like Courtney does, you're looking down a lot, so your posture could be compromised. So what we're going to find is any type of compression in the joint. I already found one right there. And just do a thoracic adjustment. Go ahead and breathe in and out. There we go. Good. Now that's bonus. Nice. Next thing I'm going to do is check the lower back, find any tight musculature, which I always find some right there. So I'm going to pin this muscle down. What I'm going to have you do is take a deep breath in, try to push my hands out with, yep, exactly, your breath. And what this does is it kind of allows, and breathe out. There you go. Do that 3 or 4 more times. And what this does is it allows the muscles to relax while under pressure. And so it causes a tight muscle to eventually let go. And it can help with a lot of postural tight muscles, like we see here. Last one. Good, okay. Go on your side, face me this way. So for the lower back, we check. Yep, you got it right there. Lower back, good. Go ahead and take a deep breath in and out. Excellent, nice. Other side. Do a little palpation to see which joints are moving, which ones aren't. Contact the top of the joint like so. Breathe in and out. There we go. Moving great. Okay, now for the fun part. So neck pain and shoulder pain. If you get a lot of headaches, what primary muscle could be responsible is what's called the suboccipital muscles. There's 3 muscles in the back of the head. And so what I like to do is a little bit of trigger point therapy. We find those tight muscles, pin it down, and hold it. And it hurts a whole bunch. But the longer I hold it down, the more, same thing with the back, that muscle will eventually accommodate to that pressure and release. And if that muscle is pinching on your greater occipital nerve, which is the nerve that kind of comes out of the back of the head and wraps around the skull, it can help with tension headaches. So that's what I'm doing. And Courtney will tell you, it's not fun.
Feels great.
Yes. Okay. So find that spot, good. Next one, do the same thing on the other side of the head. Pin the muscle down and just hold. And why it takes like 30 seconds to 2 minutes is varying reasons, but essentially you have to give it time for the muscle to realize that it's under pressure, and the brain will tell the muscle to, hey, you need to accommodate, you need to relax. This is a lot of pressure. And right about now, it starts to feel like I'm not pressing. Good.
I actually felt that one release.
Good. Next thing we're going to do is adjust the neck. So I'm feeling which joints in the spine are moving and which ones aren't, like right there. Contact. Left ear to left shoulder. Relax the head. Excellent. Good. Move very well. Okay, same thing other side. Good. Relax the head. Drop that shoulder. Good. Okay, another spot we can do trigger point therapy, yeah, is on the top of the shoulder, right here. Yeah, that's a fun one too. This one gets really tight, especially if you work at a desk, because as you work at a desk, so I'm holding the pressure down while I'm talking, but as you work at a desk, if you're working in front of a computer, typically your head will lean forward and then tilt up. And that is going to cause a lot of strain in this, the muscles coming from the neck into the top of the shoulder. Specifically your levator scapula and your supraspinatus. And right about now. And we can do a little bit more stretch if I kind of pin the muscle down and pull away just like that. Again, feels terrible, but afterwards feels way better. Good. Okay. Come on up.
Okay.
The next thing we're gonna do is called pin and stretch for the shoulder. So I'm gonna work on the supraspinatus. So that muscle is right on top, kind of where I was just doing trigger point therapy. But what we're gonna do is have Courtney's palm like this. We're gonna pin the muscle down. We're gonna go all the way out, across, and then pull with the other arm behind the elbow as I'm holding the muscle down. So relax all the way down. We'll do about 5 to 8 passes of this. Okay, all the way out, across, and pull. Good. Same thing, out, across, pull. Good. All the way out, all the way across, and pull. Good. 3 more. Out, across, pull, 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 pull. Good. The most important part of the stretch is the very end. All the way out, across, and pull. So getting that extra bit of stretch right now. Good. Last one. All the way out, across, and pull. Good. So that gets more supraspinatus. The next thing we're gonna get is the back of the shoulder. So same concept, but instead of going out in a horizontal fashion, we're gonna go out and then up like that. So same thing, out and then up and then pull. You got it. Okay, all the way out, across, and pull. Good. And this is getting some of the muscles of the rotator cuff. Out, across, pull. Good. Out, across, pull. Good. Out, across, pull. 2 more. All the way out, all the way across, pull. And last one. Good. The last stretch we're going to do for the shoulder is going to be what's called the levator scapula. So that attaches from the back of the neck to the top of the shoulder. So I'm going to have Courtney look up. I'm going to pin this muscle down. You're going to tuck your chin to your chest, look to your right armpit, and pull on the top of your head. Like that. Good. We'll do that same amount of times, 5 to 8 reps. Down, right, and pull. Good. All the way up, all the way down, right, and pull. And this is one of those techniques that, again, doesn't feel very good during, but afterwards the neck is a lot looser, a lot less tension on the nerves, and helps with the muscle pain. Down, right, pull. Good. 2 more. All the way up, all the way down, right, and pull. And last one. Up, down, right, and pull, 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 pull. Good. Okay. Alrighty, so that is it. If you got shoulder pain, if you have neck pain from either poor posture or repetitive stress, that's what we do here at Binger Chiropractic. So if you like that video, make sure you like and subscribe, and I'll catch you on the next one.